Various groups, including religious leaders and civil society organizations, are now calling for full inclusivity, accessibility, and better representation of individuals with special needs in SHA. They argue that the government's reform plan is falling short of its promises, particularly in ensuring that the most vulnerable people are included in the decision-making processes.
Recently, I have not seen the government very much aggressive in the issue of supporting people who are differently abled. For example, we need to have somebody who is a cabinet secretary who is differently abled, being given that position to deal with the differently abled people, just to show a great concern.
I want to address our government because, you have maybe a child with special need, but you cannot go to the hospital without SHA and maybe get help. You cannot go to the hospital, maybe get therapy because it won't cater. So I'm calling out the government to include the services that can help these people living with special needs.
Civil society groups representing vulnerable populations, including those living with HIV/AIDS, TB and malaria, are petitioning the Ministry of Health over the challenges facing patients during the transition. They have criticized the government for failing to address the needs of those living with chronic illnesses, despite the monthly deductions from salaries for the health insurance.
We therefore demand the full disclosure of all policy changes, plans, and financial implications related to the transition from NHIF to SHIF. We also demand for a review of the current framework to ensure it is inclusive, equitable, and affordable.
The groups are now demanding full transparency regarding policy changes, financial implications, and plans surrounding the SHIF rollout. They have also called for a review of the current framework to ensure it is both inclusive and affordable for all Kenyans, particularly those in vulnerable communities.
When we look at SHA, what we see is that we are told that it is vertically funded. So we are not seeing anything placed that is meaningful towards the treatment itself. So if in 5 years' time, this money that we get is not there, that means that we who take medication each and every day will not have access.
The government maintains that it's focused on ensuring effective operation of the Social Health Authority, which aims to provide affordable healthcare for all. Speaking in Chepsaita in Uasin Gishu County, Deputy President Kithure Kindiki assured Kenyans of the government's push for universal healthcare. The DP implored Kenyans to be patient.
SHA is the most transformative health program that Kenya has ever rolled out. The current challenges will be surmounted, and they were expected. So we expect the challenges to persist for a while. We are committed to resolving all the challenges, and we are listening to all the stakeholders, the professionals, and even the users of the program. We will put together all the views that are important to make sure that the program works for the people of Kenya.
The implementation of the new health insurance scheme has been marred by challenges affecting the delivery of essential medical services, with dozens of Kenyans, particularly in vulnerable communities, reporting significant delays, insufficiencies and lack of access to timely medical care, putting the lives of many at risk. Gertrude Burgay, K24 TV.